Okay, one of the things I want to explain is kind of a general concept of how healthcare, how health or medical insurance works. I know I was new to this industry. My background was in marketing and advertising. My other background was in Christian education. And so while I had some experience in business and experience in even dealing with insurance from a CEO standpoint, I really did not understand the industry. And so what we need to get our arms around is okay, what is healthcare, right? Healthcare is the idea of the maintenance or the improvement of your health. And we do this three ways, either through prevention, preventative maintenance, or through the diagnosis, going in and telling me what's wrong with me, and then finally through the actual treatment itself. And so universally, this is our understanding of what healthcare is. Now, the question is, um, who do we go to? Do we go to a doctor? Do we go to an ER? Do we go to a clinic? How does this work, right? And then, more importantly, who's going to pay for it and how do we pay for it? And so, if you get sick or disease or illness or injury, either physical or mental, there's a lot of different ways that we would go about taking care of you. I came from a sports background, so as an athlete, I understand the concept between kind of the sports medicine, being injured, having physical therapy, and so as an athlete, there might be an injury that requires a surgery. There might be an injury that requires a chiropractor. There might be an injury that requires a trainer. You may need, again, surgery, or maybe you need a cortisone shot. It just depends, right? Well, you're going to go to a different doctor, a different clinic, a different type of expert in order to deal with your recovery and your rehab. Well, it's the same thing here, except that now we're taking a look at, well, who is going to pay for these services. So typically we think in terms of having medical insurance, and usually we get our medical insurance through the company that we work with. And so this has just been kind of a universal concept and idea that we've been accustomed to for years. The problem is the industry is so shifting and so changing that what you used to understand or you used to know as, oh, I'm fully covered, I have medical with my company, just doesn't mean the same anymore. For instance, we have things like deductibles, we have things like co-pays, where you actually have a deductible amount that's deducted before or from the bill. So let's just say you broke your arm and it cost $5,000 and you have a $500 deductible. That means you have to pay $500 out of your own pocket towards that $5,000 bill. Nowadays, we're seeing, in order to keep the cost containment strategy, in order for companies to be able to pay for insurance for all their employees, what we see is that deductible is not $500, now it's $2,000. And so if you don't have $2,000, essentially your medical plan is void. If you can't come up with the 2,000 deductible, then you're not going to be able to pay for the broken arm for the 5,000. Just to see how that works. And so a lot of times, you went in for a checkup, $150. You went in for, maybe some kind of exam and a couple $100 more, and you kind of build up to that $500 or $2,000 mark. And so we're seeing a lot of problems with that in insurance these days. So again, the question is, well, how do you fund or how do you pay for your medical insurance? The other issue is, well, if I got hurt on the job, I'm going to be taken care of through L&I. Well, L&I claims are true. You can have those through your company, but they take a while to get paid. They may take months before your claim is actually processed. And so through Colonial does a little bit differently. So Colonial, we're insuring the person. We're not insuring the hospital. We're not insuring the doctor. And so payments don't go to hospitals and doctors, payments go to individuals. And so you're able to get insurance policies, let's say just based on the accident or based on a short term disability or based on, let's say, something like cancer. So again, most people don't understand if they were to have a heart attack, that their major medical is only going to cover about $50,000 of that heart attack when the heart attacks cost about $75,000. So where do you come up with the 25,000? Or cancer policies. Your major medical is not going to cover all of your cancer, and so where do you come up with the gap for your cancer coverage? We see hospital stays are going up, so hospital indemnity, which is how long you're staying in the hospital. Maybe you see something like this through pregnancy, where you need a couple extra days. And so Colonial Life is able to come along and provide assistance in those areas so that we can protect employees, we can protect their paychecks from the doctor's bills, right? By providing these policies. And hey, look, if the bill, the doctor bill is 5,000 and your major medical covers the 5,000, we're still going to pay out on our policy. And so that's just fine by us. We don't ask any questions. We just ask whether for you to prove that you were sick or injured, and then we can pay that policy out, or prove that you're unable to work for your 3 to 6 months, and we're going to pay out on that policy. And so the complexity of healthcare is extreme, which is why we need some time to sit down with not only with the owners or the HR directors in order to set that enrollment time, but really what we're asking for and what we're advocating for ultimately is that our trained, experienced, professional, non-sales people, our benefits counselors, can sit down with each individual employee, answer their questions, see what program best fits them. We're all different. I'm 50 years old. I've got 5 children. What I need, what my needs are totally different from a 22-year-old man who's got no kids and not married. Totally different from somebody else who's just starting their family. Totally different from a gal who's getting ready to maybe have a couple kids. And so everybody's different, which is why our benefits counselors sit down with them individually, no pressure, totally private. And so this is in essence a piece of the puzzle that we fit.